Welcome to the show discussing problems and issues of health with Dr. Alcena. For this segment of the show, I'm going to continue the series I began several weeks ago on osteoporosis. Osteoporosis is a very serious and common medical problem. Worldwide, there are more than 200 million people who suffer from osteoporosis. In this country, some 44 million folks suffer from osteoporosis. Some 55% of individuals 60 years or older in this country develop osteoporosis. It is a very common problem and it can be very troublesome. Now, there are a long list of things, as I mentioned before, that can cause an individual to develop osteoporosis. It's not just because of the aging process that would happen to all of us. It's not also just because some women are postmenopausal and they tend to develop osteoporosis after menopause, etc. That's just part of it, but that's not the main reasons. This is why it is extremely important for people to understand just because you go to a physician that order bone density for you and the bone density comes back showing you the osteopenia, osteoporosis, that shouldn't be the end of the story. Far from it. Absolutely far from it. Because if you let that be only the story and you get a prescription to get some medication for the osteopenia and or for the osteoporosis, and then you're told to be careful about fracture, blah, 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 then you will find yourself sometime in deep trouble. The list of conditions that can cause osteoporosis, I'll read them for you again so that you have an idea. The list is extensive: smoking, alcohol abuse, low dietary calcium, low vitamin D, lack of exercise, malabsorption, malnutrition, postmenopausal state, which I just mentioned, chronic use of heparin for whatever reason, primary hyperparathyroidism, secondary hyperparathyroidism, chronic use of steroid, kidney failure, Cushing syndrome, thyrotoxicosis, calcium deficiency, systemic mastocytosis, rheumatoid arthritis, scurvy, rickets, homozygous osteogenesis imperfecta, heterozygote osteogenesis imperfecta, hemochromatosis, Marfan syndrome, gigantism, multiple myeloma, etc. So this is just a part of the list of things that can cause you to have osteoporosis. And one of the most common, of course, is, as I mentioned last week, low vitamin D, because 90% of individuals with dark skin, such as myself, have a propensity to develop osteoporosis because of lack of vitamin D. And they say, well, why so? Well, vitamin D can be developed in the body, and the first step of developing it is to the skin. The skin gets exposed to the sun ray. The sun ray stimulates it, and the process of the development of vitamin D begins right there. And it gets into the bloodstream, go to the liver, has D25 in the liver. Assuming the liver is functioning well, then the liver sends the D25 to the kidney. Assuming the kidney is functioning well, then that transforms it into D125, and the D125 is that's the active form of vitamin D in the body. So therefore, when you have dark skin, 90% of the time, you have a good chance of developing low vitamin D. And there are another condition that is also very common, which is lactose intolerance, as I mentioned last week. 75% of black folks, such as myself, have a tendency to develop lactose intolerance. Mine is so brutal that if I even come in contact with it, even the tiny little bit, I wind up being sick for 2-3 days. It's that bad. And the reason is because you need an enzyme called lactase in order to digest lactose. Well, the older you get, the less lactase you're likely to have in the wall of the bowel that you need in order to digest the lactose. So therefore, the lactose goes right through you. You develop abdominal cramps, diarrhea, etc. 55% of Caucasian folks have that problem. And of course, 55% of Asian and other ethnic groups have that problem as well. You also have to understand some 75% or 70% thereabout of Caucasian folks have low vitamin D as well, because dietary process is also involved in the development of low vitamin D. So it's very important to see how common low vitamin D is Therefore, you can't just write somebody a prescription, say, well, here's a prescription for osteoporosis without knowing whether or not they have kidney disease, whether or not they have low vitamin D, whether or not they have primary hyperparathyroidism, whether or not they have secondary hyperparathyroidism, and the list is quite long. Thyrotoxicosis, which is involvement of the thyroid. These are serious medical problems that may first present as osteoporosis. So basically, before you begin the process of writing somebody a prescription for medication, which I'll get into later, you have to evaluate why. Why is the person osteoporotic? Why do they have that condition? If you don't do that, and unfortunately, the vast majority of women in particular depends on their GYN doctors to handle their osteoporosis problem, because that's who they see most of the time for the primary GYN care. And of course, the bulk of the bone densities that I'm aware of in this country is being ordered by GYN doctors. Nothing wrong with them. These are excellent physicians, but they don't do general medicine. General medicine is different from GYN. GYN is different from general medicine. I'm not criticizing them. I'm telling you what the reality really is, what the facts are. So this is a serious, serious thing to consider. Okay? And we talk about diet. Well, the news just came out last week. A third of the U.S. population, more than a third, eat fast food. And in the minority community, it's probably more than 50%. That's all they can afford. That's all they can afford because they're working 2-3 jobs. They don't have time to cook a regular meal during the day. They just grab whatever they can for breakfast, whatever they can for lunch, and then they wait to the second job, to the second job, sometimes the third job. They grab whatever they can, and they get home, they get up again, they start the routine all over again. On weekend, they might have time to prepare a regular meal, but one meal out of 7 meals is not enough to keep you in vitamin D balance. It is very, very, very important because let me give you a list of the food that you need to eat that has a lot of vitamin D in them so that you understand what I'm talking about. And you're going to tell me how many folks you know that are in the minority community in this country where poverty is so prevalent. People don't understand. We have 7 billion people in the world. Yesterday, the article came out, 3.4 billion of the 7 billion live in poverty. 3.4 billion people of the 7 billion live in poverty in the world. And in this country, we have some 25 million people who live in poverty. Some 14 million of them are children of ethnic background. This is serious business. Just because wealth is being flashed in front of our faces on television every day doesn't mean that everybody in America is wealthy. Or for that matter, have a lot of money. Because after all, the bulk of the wealth in the U.S. population is in the hand of the top 2%. And they are fighting like the devil every day to get more. Because money is a source of power. And power is what they want. What they're going to do with the money, I have no idea. There's only so much money that you could fill in someone's coffin. They don't care. It's a state of mind, something to brag about. Now, let's go. You have to understand when I talk about poverty, that's where I got robbed people the wrong way. In particular, some of the folks who are in the profession of medicine. I live in Westchester. I practice in Westchester. It's a beautiful county. Westchester is a wealthy country. Wealthy. A lot of people are very poor, but there are a lot of very wealthy people in Westchester. I mean, after all, it is said that Wall Street sleep in Westchester. So, therefore, somebody like me, who, when people look at me, they listen to me. Every single day I'm having difficulty in the office. They go through the so-called Valiere Alcena syndrome, because there's no way somebody who speaks with an accent like I do, who's a Negro person, should be sitting behind the desk as a physician. It's a shocking to them. What makes it even worse is the fact that they know, because I make no secret of the fact that I'm an orphan, and I was super poor. I saw yesterday in the same article, part of the folks that are poor, considered very poor in the world, are living in $1 and change per day, earning $1 a change per day. Some are making an average of $3 per day. Well, heck, I made 20 cents per day, which is one Haitian good. And I did that working 8 hours in the field barefooted with no clothes on my back, 100-degree temperature, up until I started when I was 10 years old doing that. And when I finished doing that, I was about almost 20, going on 20 when I say enough was enough. So therefore, I was making $1 per week, one single dollar per week. And when people hear this, the resentment is intense. You have no idea what I have to deal with on a daily basis. And on top of that, I had the nerve to have gone to one of the famous medical schools, an outstanding training program, and became a full professor at Einstein, a full professor at New York Medical. And on top of that, to rub it in more, I became an M.A.C.P, which is only about 500 M.A.C.Ps in the world. How dare you do that? So every single day, I have to deal not only with racial discrimination, but I have to deal with jealousy, envy, and an intense resentment. Intense, every day, 7 days a week. Because I'm dealing with folks, if they live to be 1 trillion years, they will never have a third of my ability, nor a quarter of my achievement. But they have an issue with that. They should go and talk to God. Ask God, why did you make Val an orphan? At 7, I lost my mother. Age 9, I lost my dad. And I've been on my own, frankly, since I was 7 years old, because I was living in one of those fancy cities. My mother was a wealthy woman. I was one of those kids that I was placed in those fancy places because she could afford it. But bango, 2 years later, she died, and everything fell apart. So I became one of the poorest person in the world. From being one of the richest kids to one of the poorest, all the things that she had were taken away and stolen, so there was nothing to support us, myself included. So therefore, every day, I have to deal with this nonsense. And every day, I have to push people away, creating personal animosities because I put them in their place all the time. I tell you, go and ask God, how is it that I'm smarter than you are? Just ask God that. Don't you dare talk to me about that. Okay, so therefore, poverty is something I am familiar with. I lived it. When I came to New York, I was working for $1 per hour in the factory. $1 per hour, 8 hours a day. And that was brutal. Then I make it even more brutal by shifting over to the night shift, working 12 hours from 6 p.m. to 7 a.m. so I can go to school, because I had to get myself out of that mess. That's how I get out of it. And now I have to apologize to those folks who were born in wealth, who were born with a stethoscope hanging on the top of their bassinet. No way. And I punch back every day. They came after me, I punch right back. That's right. Not physically, but of course, academically. I put them in the place. Yes. And I do it 24/7. Some of them are very nice to me. I'm very nice to them. But those who go to the Caribbean, which is a beautiful part of the world, but they go there to buy a diploma, and they came here. Now all of a sudden, they're going to tell me what to do? Give me a break. Okay? In any event, let's go over the list of food that you could see. I want you to see if poor folks in this country can eat this food, afford some of this food so that they can stay in vitamin D balance. Cheese, yogurt, beans, eggs, kale, cauliflower, chard, molasses, rhubarb, beets, almond, cabbage, bran, carrots, celery, dates, chocolate, figs, lettuce, lemon, oranges, oyster, pineapple, raspberry, shellfish, spinach, walnuts, watercress, pine chip. You know, folks don't have time here to eat all that stuff. They're rushing. They grab whatever they can here for breakfast. They grab whatever they can for for lunch, they're in their way because they have to survive like I did. I mean, I survived on American cheese, a pack of American cheese, some Wonder Bread, a loaf of Wonder Bread, and some Kool-Aid. That was my diet. That's right. That was my diet. Okay, that's what I ate. Thank God in those days I was not lactose intolerant. I don't know what I would have done with that American cheese because I had to buy me a pack of American cheese, put some Wonder Bread, and drink some Kool-Aid. And that's what I did. That's how I survived. And on weekend, I went to the store and buy some spaghetti, and so not I can't afford a regular chicken. They would have the chicken backs separately in the bag. They sell those. So the bones of the chicken. That's what I bought, and boiled that with some spaghetti, and put that in my thermos before I go to school at night. I eat a little bit of that. That was my diet. So I know about poverty. Don't you dare talk to me about poverty, okay? But just because I was poor, that doesn't mean that I was going to stay poor. So when you are poor, keep your head up. Go to school. Education is the key to the door of success. That's what's going to open the door for you. If you fall into the trap of spending your time wasting blaming people, blaming God, and so on, not even once have I ever once asked God, why did you do this to me? Never. Maybe if I did, he would have punished me. Because of all the bad things that happened to me, he gave me that singular gift, brain power, an excessively high IQ, and no one could take that away from me. They tried. Even after I became a physician, they tried everything under God's sun to take my license away for doing nothing, for being a man of color, and for having an extraordinary IQ. That was my mistake. That's my crime. And I whipped them. You could say to them, I whipped them to submission because they don't know what they're talking about. If they want to learn medicine, you have to come for me to teach them. And those that I taught are practicing fantastic medicine across the world. And those who come after me, I feel sorry for them because they don't know what the heck they're doing, nor do they know what they're talking about. So, therefore then, that having been said, let's now talk about how do we go about treating, besides the diet, as you know, most folk cannot afford it. Let's go back and talk a little bit about medication. I said I was going to do that today, right? Here we go. So let's talk about the medications that are out there after you realize that the patient has osteoporosis. My idea is to do everything you can to prove where it comes from. If you do everything you can, if the patient has a serious endocrine problem, you refer the patient to a clinical endocrinologist. If the patient has a parathyroid issue, you think that the patient needs some parathyroid gland taken out, refer them to a head and neck doctor that can take a couple of them out. If you think the patient got kidney stone, you think it is associated with the part of the osteoporosis, you could figure that out. You send the patient to a urologist for the kidney stone while you're taking care of his or medication for the kidney stone, diet, etc. So you do all that because you have to understand all these things can be associated with the osteoporosis, right? The patient had kidney failure. Well, you need yourself a nephrologist. You work up the kidney problem, you refer the patient to a nephrologist to make sure that he or she does not need dialysis or when that's going to be needed, etc., etc. So you do all that stuff. Don't think osteoporosis is just osteoporosis. It is not. It is osteoporosis, but it can be associated with a long list of serious medical problems. Right now, in my practice, I have several patients of mine who are in the mid-60s, early 70s, who I refer to endocrinologists. And their first presentation was osteoporosis. Turns out that they have serious endocrine reason why they had it. Now that part of it is being managed by clinical endocrinologists, and I take care of the rest of the medical issues. Okay? Now, all right. Now that you've done some X-ray, usually the first thing is the plain X-rays. Plain X-rays is plenty to tell you about fractures and other arthritic condition and so on. Then you follow with your bone density. You're going to see osteopenia or frank osteoporosis, and or the patient may be frankly normal. All right? So if there's a need for an MRI, you do that. A need for a CAT scan, you do that. If they didn't need that, the patient should see another orthopedic doctor because there's a fracture in the hip, fracture in the knee, whether it's because of an accident or spontaneous fracture, then you need your orthopedic specialist to help you, so on and so forth. Now that you've done all that, you've taken all that into consideration, remember, check the patient magnesium level, check the patient ANA, check the patient citrate to make sure, check the patient phosphorus, check the patient electrolyte, because I have several patients, believe it or not, within the last several years that I have diagnosed with adult ricket. How about that? Adult ricket. Ricket is a disease that is commonly seen in young boy or girls because of poverty and other issues, or unless they have osteogenesis imperfecta or something like that, that's different, that can have this problem. But I have several adults that I personally, on my own, have diagnosed with adult rickets. This book right here, African American Men's Health, I have pictures in there, photographs in there of rickets. Those were all from adults who have given me permission to put their photographs in there. How about that? Adults. So if you don't know this stuff, you're going to miss it. There's no way you're going to make this diagnosis. I don't care who you are, what you think, what color you are. You have got to know that general clinical medicine is something that requires on every day, 7 days a week, up to date to keep up with what is going on in the field of medicine in order to provide high quality care. There is medical care, there's quality medical care, there's high quality medical care, there's outstanding medical care. That is correct. That's it. Okay, it's up to you. Okay, you know what I mean. This is the way the world is. It's everything. Everything. There's always someone that's better at it. There's always something that is better. Okay, all right. So now that I've given you my little spiel, let's talk about medication. All right. The first medication that came out a very long time ago was Fosamax. Okay, so you know about Fosamax. There's Actonel. There's Evista. M.A.C.P, there's Boniva. Okay, some of them are given. Boniva is given once a month. The others are given once a day, etc. Then you of course have calcium supplement. Then you have Zolidronix injection once per year. You give one injection per year. Okay, then you have vitamin D, age appropriate doses. Then if the patient has primary hyperthyroidism, there's a whole list of other things that has to be done to take care of this particular problem. The patient has, on top of all that, has kidney stone, then you have to use allopurinol, blah, 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 diet management, and so on and so forth. So this is the list of different medications that are out there in this country to treat osteoporosis. If the patient has other associated medical problems, then of course naturally you have to treat them in conjunction with giving the patient this medication. And vitamin D supplement is key. I mentioned it last week. I'll mention it again. You have no idea how important vitamin D is. Super important because, as I mentioned, I'll mention again, vitamin D can cause depression. Low vitamin D can cause insomnia. Low vitamin D can cause infertility in both men and women. That's exactly correct. Infertility in both men and women. Low vitamin D can cause your blood pressure not to be able to be controlled by medication that doctors are prescribing, because the low vitamin D causes an overactivation of the renin, angiotensin, aldosterone pathway. That's the pathway that we have to block when we are treating you for hypertension. But if it is overactivated, because you have low vitamin D, we're running all over the place, changing medication left and right to find out why we can't control your blood pressure. It turns out that it's because on top of that, you have low vitamin D. And you have low vitamin D. How come it wasn't diagnosed? It wasn't diagnosed because people were not paying attention to your skin color. They were not paying attention to your financial situation, to your living situation, to know that you don't have enough money to eat a good diet. You don't have enough money to buy the stuff that has a lot of vitamin D in them. You'll be shocked. Some people can't afford to buy a dozen of eggs. Some people can't afford to buy a carton of milk. I'm serious. Even though and a carton of milk is reasonably cheap, but if you have lactated milk as well, some people they just can't afford that. They just don't have the money. They have rent to pay. They have kids to take care of. They're running all over the place. And when they do cook the food, they cook based on their ethnicity and their cultural background. They eat what they're culturally accustomed to, and they wind up. You have to understand the average black folks in this country eat 7 grams of salt per day. 7 grams of salt per day. They have 1 out of 2 have hypertension as part of a genetic phenomena. On top of that, you have eating 7 grams of salt per day. And the reason why you're hypertensive to begin with, because you have a gene in your kidney, which, by the way, I played a major role in telling people the world about that gene, which has changed completely, created a revolution in the treatment of hypertension. G protein coupled receptor kinase type 4, we all have it in our gene. So that's why you have such a devastating problem taking place in the poor community. It is unbelievable. It is sad to know what is going on. That's why poverty is not a shame, but poverty is something you have to fight yourself to legitimately get out of it by going to school, learn, get a profession. You could use me as an example, and I'm not being egomaniac. I'm just telling you, use me as an example. Who went to school when I was at PS 44. I was 26 years old when I got my elementary school diploma. And yet, today I'm one of the leading physicians in the world. How about that? So use that as an example, okay? Frankly, I give you permission to do that if you want to, so that you could motivate yourself to get yourself out of poverty. Listen, I'm stopping here until I see you again. Dr. Alcena saying so long and bye-bye.